Hello, my name is Jose Maria Torres Bravo. I'm going to talk about the effects on electrical stimulation on chronic wound healing. Definition: electrical stimulation is defined as the set of techniques that apply electrical current to the body with different therapeutic purposes. This is done by means of a special device that will extend the electric current to the body through two or more electrodes applied to the skin, which are capable of overcoming the barriers of the skin, subcutaneous cellular tissues, and distant to the intended nerves or muscular fiber, in order to produce biological and physiological reaction on it to be used and improve the different tissues when they are subject to disease or metabolic alteration. Electrical stimulation can be used in the treatment and management of chronic wounds, since it involves safe, effective, and efficient wounds management. The current recommendation, according to the FDA, for the use of this therapy are increased circulation and decreased edema. Different types of electrical currents can be used for wound healing: low intensity direct currents, transcutaneous electrical nerve stimulation (TENS), and high voltage pulsed currents.
Preparation of the skin for high voltage pulse current. We have swelling at the ankle. We're going to apply the active electrode here on the dorsum of the foot, so we're going to clean the skin. And the dispersive electrode will be applied here at the lateral portion of the proximal tibia. Now we will apply the pads and connect the leads. As we attach the leads, notice that one of the leads is marked active, one of the leads is marked dispersive. So the active lead is the lead that I'll use and change the polarity to negative. The swelling typically is charged with a negative polarity, and so we'll use a negative polarity from the electrode here to push the swelling out of the ankle towards the positive polarity at the dispersive electrode. Dispersive, active, and we're going to set the polarity here to negative. The pulse duration is 40 to 100 microseconds. Many times that's preset within the unit. And what we are going to do is, as I add the current, I want you to feel a moderate tingling. Okay?
There.
Okay, good. You can tolerate that?
Mm-hmm.
Okay, and we're just going to leave that there for a little bit. We're going to remeasure the swelling and see if it makes any difference. Okay, if at any point in time you need us to stop, make sure you know we have a bell here that you could let us know. After the 30-minute intervention, we are going to ensure that the device is switched off. And now we're going to ask the patient, how are you feeling right now?
Good.
Okay. I'm going to slowly remove the pad and check your skin. The skin condition looks good. Observing for any rashes or wheals. Otherwise, the patient looks good and the treatment is complete.
Application in physical therapy. Physiotherapy uses high voltage pulsed currents. Is the most widely used for the treatment of chronic wounds. Electrostimulation is clinically indicated in pressure ulcer categories 2, 3, and 4. Venous, arterial, neuropathic ulcers, non-healing surgical wounds, and traumatic wounds. Contraindicated in basal or squamous cell carcinoma in the ulcer or in the perilesional tissues, melanomas, untreated osteomyelitis.
Hi there, I'm Darren Sorensen. I'm a student at Elon University for Physical Therapy. Today I'm talking to you about high voltage pulse current electrical stimulation to treat chronic wounds. In a study by Pollock et al. Titled High Voltage Pulse Current Electrical Stimulation and Wound Treatment, they used HVPC treatment for stage 2, 3, 4, and 4 pressure ulcers, as well as for chronic leg ulcers including venous lesions. Under the time frame that they use and the parameters that involve that we'll talk about in a little bit, they found significant wound closure after measuring wound size after 4 weeks. One study was followed up to full wound closure, but the rest had significant wound closure that correlated with full recovery from these lesions. So going through some of the parameters that they followed, this study was actually a correlation of several studies, and they found that the best parameters to follow was a pulse duration of around 100 microseconds, voltage anywhere from 50 to 200 volts, with the intensity being emphasized to be at the sensory level and not having any motor activation. The frequency was usually around 100 to 105 pulses per second, and each treatment session was roughly 60 minutes, 5 to 7 times a week. It was noted that in only 45 minutes of treatment, you could have significant wound closure in just that amount of time as well. So looking at the placement here, we have a nice ulcer here on my patient's leg, drawn with a blue marker. So for the first placement is directly within the wound bed, and the second electrode placement is 15 to 20 centimeters away from the treatment electrode in healthy viable tissue. And in the studies that they researched, they found that using a negative electrode as a treatment provided the best results, and then a positive electrode on the healthy viable tissue. So after performing these parameters, running the electrical stimulation for 45 to 60 minutes, there should be positive results after 4 weeks of treatment.
Pros and cons. Pros: promote wounds healing in acute and chronic stage. Activates the healing process. Monophasic pulsed currents applied to a wound simulates or enhances the bioelectric currents and thus healing. Cellular electrostasis of macrophages, neutrophils, and fibroblasts in the wound also promotes healing. Improve the synthesis of protein and collagen and the production of ATP and DNA. It can increase blood flow and capillary density. It is effective in chronic wound, venous ulcers, stage 2 and 4 pressure ulcers, and diabetic foot ulcers. Promote the growth of granulation tissues. Cons: can cause burns, patients with cardiac pacemaker change in skin sensitive. For pregnant women, electrical stimulation is somewhat counterproductive if applied to the abdomen area. People with epilepsy, with thrombophlebitis, active or uncontrolled phlebitis.
It's as close to a medical miracle that I've seen in my 30 years of doing pain management.
It's exciting technology designed by Abbott that's empowering people to just go out and live their lives. DRG therapy provides relief from difficult to treat chronic pain of the lower limbs in patients with complex regional pain syndrome. It's a huge deal. 1 of 5 people in the world suffer from chronic pain.
I mean, my life just is nothing like it was before I had my first knee surgery. CRPS, it's an ongoing pain. When you wake up in the morning, it's there. When you go to sleep at night, it's there.
People who are suffering, they've lost their quality of life. They can't work, they're not mobile.
We don't really understand why it occurs, and it can be quite debilitating.
Because you are in so much pain, it's a very isolated life.
This is the actual implant design that we start with, and it represents the circuitry that we eventually miniaturize down into this small board. Proclaim DRG stimulates the dorsal root ganglion, a bundle of nerves that joins the spinal cord. We're able to target lower limb pain very effectively. This technology is really revolutionary in that, as compared to previous technologies, you can stimulate exactly the area you want to bring relief.
What does this mean for you?
Freedom. Really, freedom from the opiates, freedom to get a social life.
We are the first implant to use Bluetooth, which allowed us to have people use a device they were really familiar with and communicate directly with their implant.
So this green bar that says therapy is on means it's on and working.
Okay. When I came in this morning, I was in discomfort, difficulty walking, but I feel a sense of calm right now with this leg. It's like a miracle when you've been suffering with this. Mentally and physically, I'm feeling better.
The reaction that I've seen is overwhelming. People are often crying right in the recovery room.
You know, I felt how I used to feel. This is a gift to reclaim my life.
I love solving puzzles. At home, it just requires time. You just look for the piece that fits. At work, we're looking for the perfect fit, but the impact to people's lives is huge.
Conclusion: the management of electrical stimulation therapy should be indicated for wounds that are difficult to manage, after the use of other therapies that have not had good results. Although electrostimulation therapy works and has been shown in different studies, it turns out to have a complicated application both in primary care and in specialized wound unit.